Folks, it is right around 7:01, so we'll get started. My name is A'Jamal Byndon. I'm the chair of the board of MORE, which is Movement Omaha for Race Equity, which is an organization that deals with racial diversity issues, racial conversations, racial healing, and it's been around for over 10 years, and we recently changed our name to deal with some of the issues that we've been working on greatly in the community. And so this is one of those events that we are kind of excited to be able to bring to you, particularly to elderly or people who are getting close to the age of 65 and older, who may have questions related to the Medicare process. So let me start by introducing our guest presenter today, Gina Landsperger, who has a background in healthcare, and she received her Bachelor of Science degree from Mount Marty College in Yankton, South Dakota, and a Master of Science degree in nursing from the University of Nebraska Medical Center here in Omaha. She has over 15 years of experience working as a nurse and a nurse practitioner. She decided it was time for a career change when she realized the only time for her next career was to meet two objectives. She wanted to be able to continue to help people, provide the opportunity to serve her community. She saw a great need for someone to walk retirees through the Medicare maze, also become an insurance agent. She specialized in Medicare, and it helped fulfill her objectives and fulfilled her needs as a practitioner professional. I met her about almost a year or early this year when I was dealing with the dysfunctional healthcare system, and I was trying to sign up, and she actually helped me out greatly and make some great decisions. We interviewed her some months ago and decided to invite her back during this enrollment period because she has a wealth of information and, of course, expertise that can help us deconstruct the maze of signing up for these various programs. So, Gina, welcome to the program dealing with Medicare and helping people of color and so on, and low-income people in our practice. And our first question we always ask our guests, or say to our guests, can you tell the participants a little bit more about yourself from your vantage point?
Sure. Well, as A'Jamal said, I had a background in healthcare and really wasn't sure what I was getting into when I decided to become an insurance agent. I did have a lot of pushback from people who weren't supportive. And I found out that I have to overcome those objections. And I really, really enjoy what I do. I'm passionate about being able to find ways to save people money and figure out programs that they might not be aware of that can really help them when it comes to their health care. Because I don't want anybody to decide whether or not they're going to eat or heat their home because they can't afford to pay for their medicine or health care.
Mm-hmm. Now, Medicare, as we know, is a complex process of many seniors or the elderly. First, provide a brief overview of Medicare in terms of, I know there's an A, a B, and a D, and there's some other alphabets I heard down the road too, but those are the main ones that I think concern us today.
Yes, it's kind of like alphabet soup. So I like to explain it as you have parts of Medicare that come from the government. That's your A and your B. So Part A of Medicare, you typically do not pay a monthly premium for that because you've worked and paid into Social Security, Medicare taxes your working life. So Part A of Medicare is what covers your hospitalizations. So if you're ever admitted to the hospital as an inpatient, skilled nursing care, and that's when somebody is hospitalized and they aren't quite ready to go home, but they don't need hospital level care. They might go to a nursing facility or nursing home and receive extra therapy. Sometimes they need special IV meds before they go home, and that's paid for out of Part A of Medicare. Home health and hospice also are billed to Part A. Part B is your outpatient or doctor insurance. Part B is what we pay for out of pocket every month, and that typically comes out of your Social Security check if you're receiving benefits. If not, you're billed quarterly for that. And this is the biggest surprise when people join Medicare. They all join and think it's going to be free. And then they're surprised when they sign up, if they figure out how to sign up. That's another hurdle. They find out that they have to pay a premium for that. And that's one of the things too that I like to do is screen everybody that comes to visit me to see if there may be a candidate for the state to pay for their Part B premium. Mm-hmm. But Part B next year will cost $164.90 per month for everybody joining Medicare. Some people do pay more if they're higher income earners. But that covers doctors, surgeons fees, surgeries, ambulance, whether it's by the ground or air, your preventive services, x-rays, radiology, lab work. So essentially anything that's not done inside the hospital when you're admitted to a bed is billed to Part B. Part B does have a deductible, but it's a very nice deductible. It's $233 this year in 2021, and it'll go down to $226 next year. So with A and B of Medicare, they don't cover all of your expenses. That's why people can choose to receive their Medicare in one of two ways. You can either have original Medicare, your A and B from the government, and pair that with a Medicare supplement plan, because on Part B of Medicare, the government pays 80% of the charges and you're left with the remaining 20%, and there's no cap on that. So that's where your supplemental policy comes in. That is another insurance premium that is paid to the private insurance companies. And A and B and the supplements have no coverage for medications that you fill at the pharmacy. So you must also buy a drug plan. That's another policy that is paid to a private insurance company. The other option of receiving your Medicare is through Medicare Advantage. Medicare Advantage is private insurance companies providing your Medicare for you. How that works is the government gives each insurance company an allotted amount of money. It's typically $1,000 per month per person on that plan. The insurance companies are expected to take care of all of their members' medical needs with that $1,000. And that's how they're able to get away with the dental, vision, hearing, all those added benefits you hear about on TV. And so if you have a group of people who are healthy, they're able to beef up those benefits. But they also can keep costs down by having rules like you have to stay within the network. Some services may need pre-approvals prior to having them done. And those pre-approvals are typically for more expensive things like a hip surgery. The doctor may say that you need to have hip surgery, but it has to go to the insurance company for the actual okay to have that done. With your other option of Medicare from the government, if your doctor says it's medically necessary and it's a Medicare covered service, it's covered without that pre-approval. So Medicare Advantage, also, you just want to make sure before joining any plan that your doctor is in network, your hospitals are in network. There are many benefits, and it's important that you understand those benefits so that you can use your plan to the best of its ability. I was just going to say the drug coverage also is included. So it's one plan, one card, and it's pay as you go. Those monthly premiums are very low, and you pay for services when you use them. So your costs can fluctuate from month to month.
Let me interrupt a couple of points that is not clear. Number one, when you use the word your copay of $226 or whatever you're going to pay, is that for the whole year, or you don't pay copay every time you go in? There's a different copay you can pay each time you go in. So explain the difference.
Okay, so that $226 is actually the Part B deductible. So before Medicare Part B pays for any service, you pay the first $226.
For the whole year?
For the whole year, yes.
Not each time you go into the doctor. Okay, gotcha.
Correct. And then Medicare picks up their 80%.
And then the other thing you alluded to is you got to know these different plans or variables or whatever. How do you know which plan is the better plan financially when we don't know anything about any of the plans? How do people navigate that concept?
That's a good question. So what I do is I typically tell people when they choose that first route, your Medicare A and B from the government paired with a supplement and a drug plan, that's going to be about $300 a month. Yes, it's expensive. $300 a month in premiums that you're paying. Just know that when you go to the doctor, your care is taken care of. There aren't the out-of-pocket costs. When you look at the other side of things, the Medicare Advantage, you still pay your Part B premium. They talk about all of these free plans, but you still have to pay your Part B premium, which is $170.10 this year. And it's actually going down next year to $164.90. You still pay that every month. And the Advantage plans either have a $0 premium or they can be up to maybe $25 depending on the one that you choose.
Gotcha.
So those plans are probably around anywhere from the $170 to $200 a month. And when you use the plans, then you have co-payments.
Gotcha.
So the more expensive services may be like a hospital stay, maybe $350 per night in the hospital, up to 5 nights. After paying for each night, up to 5 nights, then it's completely covered. If you follow on that, that's.
Gina, I have a number of questions we'll see if I can get through because I know we're chasing time a little bit, but what is the most significant changes from, wait, hold on. What is the significant changes from like this year and next year from what you know of? What do you see as a major thing that we need to be aware of?
The biggest thing that I can think of is the Part B premium is going down for the first time. We're typically used to it going up. So it's going to drop from $170.10 to $164.90. And along with that, the Part B deductible is dropping from $233 to $226.
Gotcha.
On the medication side, the insulins are going to be capped at $35 for a 30-day supply, as long as it's on the drug plan formulary.
Good, very good. Now, I one of the other things came to mind is if an enrollee shopped around, how much money they save, and does that relate to the out-of-pocket payment? So in other words, if somebody did their homework and shopped around, how much can you save? And I'm saying that in a hopefully a respectful way,
Sure.
so that people are not taking advantage of.
No, I looked at a drug plan earlier today, and this is what I like to show people. So it kind of hits home on the importance of shopping every year. I showed him his current drug plan was going to cost $1,400 more for considering the entire year. So we're looking at cost that you pay at the pharmacy counter when filling your medicines and the plan premium. So he changed plans and saved $1,400 because
Wow.
yes, his premium was going to be less. So the amount that he pays from month to month is less. And then the cost to fill his medications is less. And he happened to be on 3 different brand name medications. I didn't even factor this in, but I found the patient assistance programs for each of those medicines and gave him the information. And just looking at the general qualifications, he's likely going to qualify, and the manufacturer sends those medications to him for free.
Wow, very good.
Yes, significant.
Education can help and make a difference. In terms of what is this enrollment period and why is that important? If someone should miss it, are they out of luck, or do we have exceptions to this enrollment period? Because I've heard a lot about this enrollment period.
So right now we're in the annual election period, and that's the time to be shopping for your prescription drug plans or looking at your Medicare Advantage plan, depending on how you receive your Medicare. Any changes made during this time of year take effect January 1st.
Okay.
So, and there are only certain times of year that you can change plans. You might make a change right now and decide that that wasn't a good fit for you. If you're in Medicare Advantage, you can make one change during January through March of next year to get into a new plan in case your plan does not fit you. With prescription drug plans, you aren't quite as lucky. You're typically stuck in those for the entire year. There are a couple exceptions. People who receive assistance from Social Security paying for their drug plan premiums and drug costs can change plans throughout the year. They typically get one change per quarter. And then anyone on Medicaid also can make changes throughout the year.
Got you. Good. Another question comes in the community of people of color, the elderly, and there's inadequate outreach to the elderly, our senior citizens dealing with various public programs in general. How can we notch up these services if people lack, number one, literacy skills, the internet, or just basic communication equipment like a cell phone?
I think it's it's great to spread the word. If you hear about a program or you're helped by a program, I think it's great to share it, because not everybody's going to take the time, if you're meeting with somebody for Medicare or these other programs, to explain it. I know that they do have different organizations around town that provide the education to seniors, but it's a matter of finding out where they are and who does them and how to get the information. So it's not well known. I do think that we need to be sharing with our friends the information that we find value in.
And our experience has not been a lot of community outreach. Back in the day, there was all community agencies and networking and things that happen, even word of mouth, a little bit more extensive. And now with COVID, and people have to rely on this technology, sometimes there's this digital divide between low-income communities and middle-income communities, and administrators or bureaucrats who work in government or public assistance programs. So we got to do a much better job. I was noticing in the Medicare handbook, and I'm going to hold this up because this is like considered, I won't call it the Bible, but it's considered the information for basic understanding of how Medicare work. But then is there a unique number for insurance counseling? In other words, some people, the way this is written, you have to call between a certain hours, like let's say 8 to 4:30. And again, those are business hours, but some people work evening hours and can't always, or work daytime and they can't get away from their jobs and make a phone call like some people. So my question to you is, what other ways can people contact someone after 4:30 on weekends? Do you go to private people, or if you can't do the 8 to 4 with these government assistance programs? How do you do that? Or can you contact some of them nationally from all outside of these 8 to 4, 8 to 4:30 programs?
So sometimes they will have email, but that's granted whether or not the person looking for the assistance has email. They do have the Volunteers Assisting Seniors program here in Omaha that offers monthly meetings in Omaha that you can go to get general information. And our public health centers, One World and Charles Drew, both have counseling services too for people who need assistance with finding programs and walking through Medicare.
Okay. Now this may sound like a strange question, but when people work in healthcare, and again, you've been a nurse practitioner and working in healthcare, did you get education on these kind of programs, even though that may not be your area of expertise? Do they talk about it in any classrooms or whatever you do in healthcare?
Not really. So being on the caregiving side, I really didn't know much about the insurance world. I had to learn it all. I've done a lot of reading. The one takeaway though that I found is the hospital staff knows the types of plans that require extra paperwork, and they're usually pretty vocal about that.
In other words, they like it, or don't like extra paperwork.
They don't like it because some programs allow it to slide through without any extra documentation, and other times the insurance companies will come back and say, you know, I don't think this is necessary. The doctor needs to provide more information before we'll cover this service.
So a follow-up to that, then, if you don't have a computer and you don't have access to you're out of luck, because you said you can't use paperwork to sign up for any of these programs, or can you?
You can use paper to sign up for the programs. The thing is, the paper can be very, very confusing. Just a layperson reading through the application booklet, they talk about all these different terms. And then in order to sign up for a plan, everybody has to have a valid, what they call election period. And essentially what that is permission to sign up for the plan. And you have to check the correct one to get into the plan as well.
Wow.
Yes.
We're getting caught at the end in terms of me asking you questions. I want to give the people who are on the Zoom the chance to maybe raise a question to you here. Are there anything else that we need to be aware of with this signing up for Medicare, and particularly this year, from your vantage point?
So the biggest message I want to give is, you know, it's important to look at your coverage from year to year. You really do end up paying a lot more money if you don't look at that. So that's just really important. And also be sure that when you're talking to somebody about Medicare, they will tell both sides of the story. You hear the good and the bad, and they also tell you that there are two different options to receive your Medicare. And it's really up to you to decide what's best for your healthcare needs.
Okay, good. Well, I'm gonna just, at this point, if somebody on the Zoom want to raise a question or comment or anything, we feel free to do that. I always have lots of questions myself, but I wanted to give other people a chance to ask or raise an issue. With Gina.
Hi, Gina, thank you for that information. I was wondering about something that you just said, and I know you were kind of talking about this, but you go make sure you look at your coverage from year to year because you'll end up paying more if you don't. And I'm not sure why that is.
That's because on your drug plans and your Medicare Advantage plans, the medications that they cover change from year to year. So you want to make sure that your medicines are on the covered drug list. And I know last year we ran into this. I'm not seeing it as much this year, but one of the big prescription drug companies dropped Walmart as a preferred pharmacy. So people found out when they went to go fill their prescriptions that they could no longer use that pharmacy if they didn't look at their plan. And then with the Medicare Advantage, the doctor may not be in the network for the next year. So you definitely want to make sure your doctors take the plan.
I see. So they don't contact you to tell you these things.
Every September, they mail out what's called an annual notice of changes. And, I have people that call me and say, I got this, I've read it, everything sounds great. And other people don't even look at it. It gets lost in all the other Medicare mail that you're receiving.
Okay. So if you're alert, you would, or if it didn't move or something, then you're okay.
Yes.
Okay. So from what you were saying, it sounds like you have a higher premium if you have a supplement,
That
but
is
higher services if you have Medicare Advantage.
yes. So with the original Medicare A and B with the supplement, there's no dental, vision, hearing, gym membership. There's none of those added perks. What they provide is very comprehensive coverage, knowing your costs when you go in to receive care. An example of how a Medicare supplement can work is you can spend an entire year in the hospital and have no out-of-pocket cost except for your monthly plan premium. So that's really good peace of mind. So if your premium's $100 a month, that $100 is all that you pay each month. Your premium will go up every single year, but but it is peace of mind. With Medicare Advantage, people like to save the money because they don't need to buy a dental or vision policy, or if they're healthy, they really aren't using those services. So they're seeing a savings in not paying the monthly premiums. The one takeaway is you have a one-time opportunity to buy a Medicare supplement plan, and that's within the first 6 months of starting Part B of Medicare. After that, you have to be able to pass the health questions in order to join that type of a plan.
And then they can reject you if you have pre-existing conditions?
They can, and they can also, if they don't reject you, they can also charge a higher premium.
So they were able to keep the pre-existing conditions in there as a criterion, even though I thought those were eliminated with
the Affordable Care Act. Yes, so that pertains to under 65 health insurance and the major medical plans. The pre-existing conditions, you're still covered by Medicare for those pre-existing conditions. It's just the supplement can reject you. And I guess I don't know a good way of explaining it, but that law did not apply to the Medicare supplements because everybody who's healthy would stay on an Advantage plan. And as soon as they get sick, they would want to jump over to the supplement side. And that would break those supplement companies.
Wow. Did not know that.
Yes.
Wow. There was another question jumped out at me. You alluded to this supplement Dental and eye and glasses are not covered. How do you get that covered if you are in A and B? It has to
You
be
can,
D then, or will that cover D?
D is for drugs, so that only covers your prescription medicines. You would have to buy a standalone dental or vision policy.
Hearing aids also the same thing?
Yes, yes. And there are, so they have, you can either purchase dental or vision alone, you can pair them, or you can do dental, vision, and hearing together.
And what are we talking ballpark? I have no clue what we're talking money.
So dental, well, vision policies start from $12 to $15 per
A month.
month.
Okay.
Yeah. If you choose to do a dental policy, those typically start around $25, and that will cover like your cleanings and exams, x-rays, and then you'll get some coverage if you have a cavity or a root canal that needs to be done later on. There are typically waiting periods before those bigger services are covered, or at least covered with a significant amount. Many of the plans have you wait 12 months before they would cover a root canal or a crown, because people typically are looking for dental insurance when they need expensive work done.
Yeah, I was surprised they did say that to me. They said you have to wait a whole year before doing any major work. They'll just do the basic cleaning and so on
Yeah.
like that. But
Okay.
and then they did make me pay a little bit out of my pocket, which I'm going to check on that also, because I thought they would cover that. But again, it's one of those things. The other thing, and I think it goes back to something Shireen asked about these coverage costs and getting into the system. If you miss getting into the system, you can't get in at any point if you miss that turning the lock-in period or whatever that is, enrollment period?
So they, if you miss your enrollment period, you have to wait for the general election period, which is January 1st through March 31st. They are changing for 2023. You used to have to wait until July to start your coverage. Now they're going to start at the month after you sign up.
Wow. So there's a window you have to, and you got to know that in order not to mess up, because I think it's very important.
Because they'll penalize you if you miss it.
Wait, I'm sorry, did you say the enrollment period is different than the annual election period? Is that what you're saying?
Yes, so there are different types of enrollment periods. Like right now, this time of year, it's for people who are already on Medicare. So they're looking at any plan changes. If you are turning 65, you have a window, it's 7 months, it's 3 months before your 65th birthday, includes your 65th birth month, and then it extends 3 months after your 65th birth month. That is the time to sign up for Medicare. If you sign up on the month of your birthday or after, the coverage starts the following month. And that's another fix that's coming for next year. That's exciting. So it used to be super confusing. So I'm glad they fixed that. The other thing is, if you're somebody who chose to work past 65 and stay on your group insurance, you are welcome to do that as long as your employer employs more than 20 employees. You can leave your work insurance at any time and join Medicare, but you want to make sure that there's not a lapse in coverage between your group insurance and Medicare coverage.
Yeah, I faced that problem where I left my employer and they made me document that I had coverage, and then my wife was on my program, and it took us almost 2 to 3 months to get in the system, even though we had coverage, but we had to go through another agency to get the records, and there was a lot of confusion. But again, they were saying you didn't sign up at the age of 65, and I said, but no, we were covered through work insurance, and it was much better with them. And then again, it was that confusion, but it was a snafu, and it's just difficult to go through that maze. And again, I had to contact Social Security, Medicare. I mean, it was crazy. It's just craziness. We have not talked about Medicaid, and I wanted to bring that up at one point. I know a person who was going to think about getting on Medicaid, and they were afraid of losing their home and some things like that. Talk to them to the difference between Medicaid and what we're talking about Medicare today.
Medicaid is a state-funded program that's for people of lower incomes and lower assets. So you have to financially qualify for that. And some people may face like losing a home or something, because that's how a lot of nursing home care is provided. And I always tell people when they do have a home that they will no longer be living in, it's always best to actually contact some legal advice prior to the time that you're facing this, because it's best to plan ahead to preserve any assets that you do have if you have family that you want to leave those assets to, because they do have, and if I remember correctly, it's a 5-year look back of gifting like a home or significant amounts of money. But for an individual who makes less than $1,153 per month, they can receive full Medicaid benefits as long as their assets are less than $4,000. And those benefits really do mean a lot, because that means that the state will be paying that Part B premium for them. And then all of their medical care is taken care of. They don't have the out-of-pocket costs. And the Medicare Advantage plans that are available to people who have both Medicare and Medicaid have excellent benefits. And this next year, they are even helping pay utility bills. So that's
What?
really, yes,
Okay,
yes.
you lost me. You mean Medicaid program is going to help pay your utility bill?
Yes. So, it's incredible. You may hear about like the food cards and everything on TV. So when they reference that, they're talking about the Medicare Advantage plans that are available to people with both Medicare and Medicaid. It's incredible, the amounts, and I've seen them change people's lives. Those really have been good things for people.
Wow.
But
But you have to have an income of less than 1,100 a month to get into those programs?
$1,153 for a single person. And, I've seen when somebody might be $20 over that amount, and they do count premium, or they do deduct premiums that you pay for like a dental policy or something similar. They deduct that policy or that premium from your income. So if you're $15 over, you buy a $20 policy, you then could qualify for their Medicaid.
Oh, wow.
I saw one lady that was $1 over.
Wow.
So, yes.
Yeah, I've been around people who really are really firm about not going over. And so, yeah, there's other ways to be creative, but I also know sometimes can't be on another level. Any other questions or any other feedback, Shereen?
Well, I was kind of wondering about, like what about people who are, they become sick or something and they're elderly, and they need long-term care. I understand that like Part A might do nursing home, but it's only for a limited number of days. And what if someone has no savings, what ends up happening to them?
So Medicare has no coverage for the long-term care. They will cover the skilled nursing stay when you're in the nursing home to rehabilitate and eventually go home. There is one catch on that. You have to spend 2 midnights in the hospital before Medicare will pick up that skilled nursing stay if you're on regular Medicare A and B from the government. So for the people who need nursing home care and really don't have a lot of assets, it typically goes to the state for Medicaid. And that's where I say it's best to seek legal advice if you're able to, so they can help you protect any assets if you have anything and just help you through that process.
Mm-hmm. Wow. As you had mentioned that, something just hit me because we did a program the other night dealing with Mexicans and Mexican Americans, and I don't know much about this, but if a person is from another country, like a senior with a permanent resident, can they get the program and then do these programs to help seniors who are undocumented? And I've heard some of the conversations in Lincoln about they don't do any of that, but I'm not sure. If somebody's a senior and they need health care, how's that met for somebody, even if they're undocumented or a permanent resident with Medicaid rather?
I don't know the answer to that with Medicaid. And, I would hope that the hospital would, or wherever they're seeking care, would do the right thing and take care of the person. And, they do have to have write-offs from year to year, but I don't know the answer to your question.
Okay, because I think there are people who come over as permanent residents and so on, and bring their relatives or grandmoms over and so on. And I've never heard people talk about how they're covered through our healthcare system. But again, it's one of those things that if we're reaching some of the people who are low income, that would be a group. But I do know that in our state, there's someone adamant about not helping undocumented families. But as you alluded to earlier, the law is very clear that if someone is emergency need health, we have to provide that regardless whether they're permanent residents or undocumented or anything. And so that's been a big issue in our social justice area. Any other feedback, any other questions, anything else? I have two more and then anything else. Anyone else have anything else?
Do you just sign up for Medicare at like medicare.gov or something?
So it actually starts at Social Security because they have to verify that you have enough credits to receive premium-free Part A. And then they also look at your tax returns to determine how much you'll pay for Part B, because higher income earners do pay more for their Medicare. So, and I guess I should say anybody who receives Social Security 3 months prior to their 65th birthday will automatically have their Medicare card mailed to them. Signing up, you can either create an account on ssa.gov, which is the Social Security website. There's a Medicare section in there, or you can call the local Social Security office and they'll make an appointment to talk to you on the phone. They still aren't, or at least a couple months ago, we're not doing Medicare appointments in person.
Wow. One of the things that when I signed up, I found it strange. I had to wait 20 and 30 minutes for somebody in Washington State to answer. Then sometimes they refer me to the local Nebraska office. I wait again another 10 or 15 minutes, and I was complaining profusely. And they basically instructed me to contact my congressperson or senator because the whole system, it takes you that long to get in there. And sometimes it's just a one simple question that I have, and it was difficult, I must say.
I find that interesting that you recommend, or that they recommended contacting your local government official, because I had to do that this summer with somebody. Social Security was not processing their applications for Social Security benefits or Medicare. And it was months. And we finally said, you know, we're going to involve the local government.
And their suggestion was me to advocate for more workers because they act like, at least they told me they were overworked. They had coming in all over the country. So they were saying, contact them basically because they can't help themselves. It's taking so long to answer the phone. But I did find the people locally a little bit more nicer. And again, they were like local yokels who we all know each other kind of. But when I dealt with the national office, they sometimes gave me different information. But I also found it strange that they just were not as customer friendly as I thought they would be. The fact that I got to pay taxes to these individuals, it was just strange. But I really think we need more people to help clean that system up. It was that bad for us.
And a pro tip on that, if you have to call Social Security in the local office, call right away at 9 o'clock when they first open. You won't wait near as long as calling any other time of the day.
4 o'clock in the afternoon, in actual fact, a couple of times they hung up on me. I'm gonna tell you that right now. I mean, who am I? You know, so I have to call back in. I had to use different phone numbers. It was weird. It was like I was dealing with some crazy situation.
They have had phone line issues actually, and they've acknowledged that. And some people have even missed signing up because of those phone issues. So they are, yes, it was a big problem.
By the way, you just alluded to people's getting services can depend on how much income they have. So if somebody's a higher income, they're going to pay more. I thought it was universal.
No. So the cutoff for the standard premium for Part B is 92,000. So if an individual makes more than 92,000 a year, they're going to pay more for their Part B. And I don't have the numbers in front of me, but people can pay like $500 plus a month for Part B. And they also pay more for their drug plan.
Wow.
Mm-hmm.
Is that what about someone who's married? Is there a higher cutoff for them?
It is, and I think it's 184. It's double the single person. So, and that's filing jointly. They do not like it if you file individually and you're married.
Wow. By the way, I heard the drug costs went down because they were experimenting. There was an Alzheimer's drug they thought they were gonna have to pay
Yes.
for last year, and so that was one of the reasons why it went down. But can we, as citizens, we can't control these costs? I mean, you can't advocate and say, hey, to my state senator, or not state, but U.S. senator or congressperson, we shouldn't be paying that, because I always thought it was free, even to up until late in life. And now I'm like, man, I know it's going to cost me this much money out of my meager Social Security check. I thought, I mean, that was part of living in this country and saluting the flag and being patriotic. That they give us free stuff as we get older people, Don't work that way, right?
It doesn't, and so many people, it's like, gosh, they were going to take care of my retirement. They were going to take care of my healthcare. I was going to be taken care of. And it's a rude awakening to actually stop working and join these programs. But it's the Medicare Board of Trustees who determine the premium from year to year. And they look at actuarial science to figure out the numbers, but they really over projected the cost because of that Alzheimer's drug last year. So that's why we have the decrease for next year.
Okay. I don't know if somebody, but my question is, what kind of numbers are we talking in terms of people that you serve or people serve in our state in terms of seniors? Do you know the general numbers or anything? In terms of how many people, in other words, everybody's in these programs because it's government, right?
Yes,
We got
yeah.
like hundreds of people, thousands of people. Anybody who's over 65 is in these programs, in other words, right?
Yeah, essentially, if they aren't working and aren't on group insurance.
Okay. Got you. Any other comments or questions? It's not that we have to go the full hour, but anything else jumping out at you?
I think the biggest thing I want people to realize is, those commercials on TV, we see them all the time. Just realize if you choose to call that number on TV, you're essentially giving your number to somebody who's going to be trying to sell you something. You don't know what their intentions are. I really hope that they're good, but if they're signing you up for a plan, make sure that it fits your needs, that your doctors are in network, your medications are in network or covered by the plan. Be careful with your mail that you receive. A lot of it is solicitation. You just watch for your Medicare card to come, and that's pretty much your most important one. And then the last one was Medicare will never call you. Just be careful about giving that Medicare number out over the phone.
Yeah, I had some people call me up a couple of times and try to get the number from me. By the way, if somebody offers you a free meal to come to one of their training sessions, indirectly, Gina, you're just saying be careful going to those free state dinners that they offer from these plans for educational purposes.
You can go to those. I mean, that's fine. You can get the free meal out of it as well as some education.
Now, you mentioned like going to ssa.gov.
Yes.
And do you have to create a new account there? Even if you already have, like, maybe you're like, some people might be like me where I'm not, taking Social Security yet. And I have an account that's with my Social Security, something like that it's called.
Yeah.
It's on a different website, I think, than ssa.gov. So it can get kind of confusing.
It can. That is one of the things that people run into. They have their accounts and then they can't get in because the logins are different. So if you go to ssa.gov in the upper right-hand corner, there's going to be a sign-in option. When you sign in there, because I'm trying to remember my account is with the My SSA, your username is typically your email, if I remember correctly. You can sign in there, but people who have created an account within the last year and a half, maybe 2 years, have to use a different button that's login.gov. But you probably will be okay. Just click when you go to ssa.gov, click on the sign in the upper right-hand corner, and you should be able to enter in your username and password and get in.
The Social Security username and password?
Yes. Because I also have one of those old ssa.gov accounts, or the My Social Security account.
Oh, I thought that was new.
They have 3 different logins. You have and I don't know exactly what the first one is, but I'd say 75% of people have the middle option. It says login with login.gov. anybody who's created a very recent account does that one. And then there's a third option that's ID Me. And a couple people have that one as well. But most people recently I've seen login.gov. I have the old one where it takes you right to where you put your credentials in.
You're a little confused. Gina, why would you have one at your age? I mean, you say you're in the system, or is it because of you as a professional?
No, actually it's because anybody can create one as long as you've worked and paid in taxes. I just figured, if I'm telling people how to do this, I should probably know how to do it myself.
Okay, now I see. I understand.
But when you log in, it sounds like it's going to be confusing. Like when you log in, will it be clear that this is the right place to go to sign up for Medicare?
So, the easiest way is, let's see, because when you click on the Social Security, the sign in, and then if you go to the upper right hand corner, it'll take you to a page where there's 3 boxes. The left hand box will say My Social Security. You click that left hand box. The first description I was giving you was when you're on the Social Security homepage, you can click on Medicare, and then it will take you to another section. And then scroll down, there will be a bright blue button that you hit, and it says apply for Medicare only. And it does ask you still in the application whether or not you want to apply for Social Security benefits. I always just tell people, be sure that you answer that correctly, because once you do elect something, it's very hard. The government is unforgiving.
Wow. That's a good warning.
So, Gina, any other comments? Well, Gina, do you have any closing comments or issues or anything, or anyone have any last things they'd like to say before we get off this Zoom presentation? And by the way, this will be posted on our Facebook account. We couldn't log on right because my browser was acting strange, but we'll post this out on Facebook. And then also, Gina, will provide your contact information if someone want to call you privately and talk to you individually as a follow-up to anything that we've talked about today. So we're going to provide that also. But any other comments or anything from anyone?
No, I think just what I want to say is be sure that when you choose to work with somebody for Medicare, just make sure that they're presenting your options, that you're comfortable with everything. And if you're working with someone, be sure that you are able to reach out to them and ask questions, because I do see this as a partnership. It's very confusing, and it's nice to have someone to just pick up the phone and call and say, hey, I got this new medicine. How much am I going to pay for it? Is it going to be super expensive? Or how much will this cost? It's just great to have somebody there to walk through the process with you.
The other thing I will say is when I signed up, I was surprised when I got to my local pharmacy. I'm not going to mention Hy-Vee, but some of the medicine was free. I was like, what's going on here? I never expected to get, and they said some kind of way, the way the system is set up, they pick up the cost of some medicine because it's more generic and it's easier just to do that as part of your premium. So there are some medications you would only pay for, even though you're paying your premium. And I thought that was a very pleasant, nice surprise. So I hope they would move that into other areas like the groceries and the meat, but they said, no, it doesn't work that way. So, but yeah, there are some medicines that are free in some of these programs. So very good. Well, I guess we're going to close at this point, but Gina, really appreciate you sharing with us tonight. And it was a pleasure to talk to you and have other participants raise questions and issues. And I hope, like I said, we're going to post this on our webpage as well as our Facebook page, so that if people have other feedback and questions, we can come back and again, have a chance to contact you about certain issues. So thank you very much for tuning in with us today. We hope you've enjoyed this edition of one of the things that we do at MORE, which is bring community people and bring information to help deconstruct some of the complex issues that affect many people in our community, particularly people of color and low-income people who have a hard time dealing with some of these important issues of the day. So thank you, and hope you can join us again. We do other programs here at MORE, which again is our goal is to help bring the worlds together. Baroko, and may the force be with you.
Thank you, Gina.
Thank you.